Hello, I'm Teresa. Over the years, I have treated many people with ankle pain. Some came to see me only a day or two after twisting their ankle. Others had already been living with pain for months or even years. Although they all described the same problem, my ankle hurts. I have learned that every ankle injury tells a different story. One patient may simply need time and support for the tissues to heal. Another may have an injury that requires further medical investigation. And someone else may have developed a long-term problem because the original injury never fully recovered. Today, I would like to share some of the clinical lessons that have stayed with me after treating many patients with ankle pain over the years. Whenever someone comes to my clinic with an ankle injury, my first priority is not deciding where to place the needles. My first priority is making sure the injury is safe to treat. I carefully examine how the injury happened, where the tenderness is located, how much swelling is present, and how the ankle moves. Most ankle injuries are soft tissue sprains, but occasionally there may be a fracture, a significant ligament tear, or even a tendon rupture. If I suspect any of these conditions, I always recommend further medical assessment or imaging before beginning acupuncture treatment. Over the years, I have learned that good treatment always begins with good assessment. Knowing when to treat is important, but knowing when not to treat is equally important. Once serious injury has been excluded, and I know the problem is a straightforward ankle sprain, one technique I often use is gentle bloodletting around the injured area. From my clinical experience, an acute sprain often creates considerable tissue congestion and internal pressure around the injury. I often explain it to patients in a simple way. When pressure builds up inside the injured tissues, the body sometimes struggles to restore normal circulation efficiently. Gentle bloodletting may help reduce this local congestion while encouraging fresh circulation into the injured area. Of course, this technique is not suitable for everyone. The patients who make me think the most are usually not those with a recent injury. They are the people who twisted their ankle 6 months ago, 1 year ago, or even several years ago. Many tell me they can still walk short distances quite comfortably. However, if they walk further than usual, spend a long day standing, or return to sport, the pain and swelling come back again. Over time, I have come to believe that many of these patients are no longer dealing with an acute injury. Instead, the body's healing process seems to have stopped before the tissues were fully repaired. For some patients with long-standing ankle pain, I sometimes choose a local through needling technique across the ankle. It is only considered after careful examination and when I believe it is appropriate for that particular patient. My clinical thinking is that some chronic ankle injuries remain in a prolonged state of irritation. Although the original injury happened months or even years earlier, the body's repair process has never completely finished. In selected cases, I have found that a carefully controlled, stronger local acupuncture stimulus may help encourage the body's natural healing response to become active again. When I examine a patient with ankle or foot pain, I also think about the meridian that passes through that area. For example, pain around the inside of the ankle often leads me to consider the liver meridian. Pain across the top of the foot frequently makes me assess the stomach meridian. Pain on the outside of the ankle often reminds me to examine the gallbladder meridian. Instead of focusing only on the painful spot, I often select acupuncture points along the corresponding meridian to improve the function of the whole pathway. Over the years, I have found that patients are often surprised when I place needles away from the painful area. Some patients come to me because they keep twisting the same ankle again and again. Sometimes the pain has almost disappeared, but the ankle still feels weak or unstable. In these situations, acupuncture is only one part of the recovery. I also encourage simple balance exercises and strengthening exercises for the muscles around the ankle and lower leg. These exercises help improve joint stability, coordination, and confidence. I remember treating one patient who had injured an ankle almost a year earlier. Daily walking was manageable, but every longer walk caused swelling and discomfort around the joint. I combined a local through needling technique with acupuncture based on the affected meridian pathway. As the pain gradually settled, we also introduced simple strengthening and balance exercises. Several weeks later, the patient was able to return to regular walking without the swelling that had previously appeared after every longer outing. Looking back over the years, I have realized that treating ankle pain is about much more than treating an injured joint. Every patient has a different story. Some need careful assessment before treatment. Some benefit from relieving tissue congestion during the acute stage. Others require a stronger local stimulus after healing has stalled. Some improve when treatment follows the affected meridian rather than focusing only on the painful area. And for many patients, recovery is completed only when strength, balance, and confidence return. Treating ankle pain has reminded me once again that healing is rarely just about making the pain disappear. It begins with understanding the injury. It continues by choosing the right treatment for the right person. And it finishes when patients regain confidence in their body and can return to the activities they enjoy. Every ankle injury is different. Every patient heals in their own way. That is why I continue to believe in careful assessment, individualized treatment, and supporting the whole person throughout the recovery process. Thank you for watching Teresa's TCM Clinical Reflections.